Susan, can you share any insights with our audience about some of the key resource and capacity management challenges that Tennessee Oncology faced before partnering with SMRTA, and how are those challenges affecting your operations?
Yeah, sure. Thank you, Priscilla. Yes, I think the best way I could probably describe operations before partnering with SMRTA is it was a little bit of the wild, wild west. We have multiple sites of service. As we saw, we have about 35 medical oncology clinics currently. And really at the time, before we joined partnership with SMRTA, everyone was just working kind of within their own guidelines, not really relying on any kind of data or analytics or any kind of standardization. It was just, how do we manage this clinic with what we have, with the resources, the space, and what we've been given. So we had a lot of challenges with what I would call the infamous bell curve of everyone coming into the infusion center between the hours of 10 and 2. And that was because it was driven a lot by the provider schedule, and it was also driven by patient availability. So we had a lot of challenges just making sure we could even out our resources, that we had the staffing in place that could help through those busy times, and then also in the downtime. It made it really challenging for our teams to be able to get lunches, to even organize the treatment room by their nursing team. From a scheduling perspective, it was really the scheduling team trying to put together what I would consider like a jigsaw puzzle. They were looking at different pieces and parts of the patient's appointment. They were trying to manipulate kind of the schedule by looking at multiple different resources, trying to piece parts together just to make things work right. And so they were just really doing the best that they could, but it was definitely a daily challenge. And without any tool or guidance to help inform our decisions, that each of the clinics were just really trying to make it from a perspective of putting all the different pieces into place, and sometimes having to move those pieces around very quickly as the day changed. So lots of challenges that were presented to them.